I'm Gordon Francis. I'm a physician scientist at St. Paul's Providence Healthcare, and I'm an endocrinologist by training. And I did special clinical training in cholesterol metabolism. So the people I see in clinic are in our Healthy Heart Program Prevention Clinic, which is largely people who inherited a tendency to have high cholesterol. So normal LDL for adults is about 3.4 millimoles. If you're always, say, higher than 3.8, despite good diet, you have some inherited tendency to have high cholesterol. If your LDL is always higher than about 4.5 to 5, you have the more severe form of inherited genetically high cholesterol. If you have inherited high cholesterol, would you have more symptoms than people who don't? And you wouldn't. You wouldn't know it. You can be a marathon runner, be extremely fit, and still have very high cholesterol because you were born with a genetic tendency to have high cholesterol. Normally, it's a difference in genes that mean your liver doesn't remove the bad cholesterol from the bloodstream as well. So it builds up in your blood and it can seep into your arteries and over decades lead to blockage formation, which only when they get severe do people have symptoms. People who have genetically high cholesterol might start showing signs of heart disease in their 30s or 40s, especially men, and especially if they're also a smoker or if they have other risk factors like diabetes or high blood pressure. So if you know, especially if one of your parents had a heart attack early, in men we call early before 55, and women before 65. So a woman could be 64 and have a heart attack, and we still call that premature. So if you have that family history, particularly in one of your parents, and then you would want to know, well, did one of them have high cholesterol? Because that's very common. And then you should be tested. And current guidelines are that we want the children of parents with that to be tested as young as age 8. So we're testing kids. We're not waiting until they're 20 or 30 to do the first cholesterol test.